Hello, my name is Dr Rick Thompson and I am the Scientific Officer for the rare disease charity Findacure. We've been working with the Children's Hyperinsulinism charity as well as Professor Khalid Hussain from Great Ormond Street Hospital to try and help us find some new treatment options for the rare disease congenital hyperinsulinism, or CHI. So we're working to try and raise £30,000 to contribute mostly towards research to investigate this rare disease. Now, as those of you know who are following the crowdfunding campaign, the drug sirolimus is looking really positive as a potential treatment, and we know it works in a certain number of patients. What we don't know is how it really affects a wide number of CHI patients, so those with different mutations, for example, and that's one of the aims of running a clinical trial. What we want to do is look at the effect of this drug in a number of different patients and really better understand its function and better understand its safety and effect in those patients. So to do this, we're trying to set up a new way of funding research at Findacure, and that's called a social impact bond. This is a bit complex, but the basic idea essentially is we're trying to fund research into drugs, existing drugs, that are quite cheap for the NHS and therefore should save money to the NHS themselves if they use them, and hopefully improve treatment for patients as well. Essentially, we want to use this money we've saved to fund future research. In order to make this successful, there are three major things that we really need to do at Findacure. The first thing is to understand the cost of CHI currently to the NHS. What does it cost to treat a CHI child? Secondly, we need to really prove that by using sirolimus, we can actually save the NHS money, and therefore we can have some savings to fund the trial. And the third thing is to show that the trial itself can be delivered quite cheaply, that we can deliver the trial at less than the cost of the money we'd actually save, and that means we have enough money to pay for it. So what we've done to try and prove this is to build a cost of illness model, and we've done this in collaboration with a company called Costello Medical Consulting. So the aim of this is just to show what we've just said. What does CHI cost the NHS? Now, there's a lot of work still to do on this model, but we've been working really closely with Khalid Hussain and the rest of the team at Great Ormond Street to try and build the model based on exactly how they treat the children at Great Ormond Street today. We've also had input from the NORCHI team, so that's the team at the Northern Congenital Hyperinsulinism Service. So with all this data, we've got a model that kind of works now, but we've still got more work to do. In particular, we want to collect more information about actual patient stories by looking at records that they might have and information from the hospital as well. We also want to really speak a lot more to patients, to run focus groups, to understand the cost of the illness, both on a kind of emotional level. What does it cost the patients to actually suffer with this disease? And we also want to understand what it costs the patients physically to go to hospital, the cost to the earnings of parents and that type of thing. And all of this will really help us understand the cost of CHI to patients. Your donations will really help us prepare sirolimus for a clinical trial in congenital hyperinsulinism. This is really crucial to help all the patients who are living with this disease day in, day out. It will also help us really prepare this social impact bond model as a new way to fund research, and that's crucial for CHI as well. What we really want to do is make sure we can deliver a trial that's going to benefit the CHI patients and give them a new drug to help them in their day-to-day lives. So please do keep donating, give as much as you can to help these patients and hopefully help all the patients in the future that are born with this really hard and tough disease.